Welcome back to It's Personal. I'm Christopher. Face, breast, body, skin, and even men. Believe it or not, plastic surgery is more common than you might think. Dr. Matthew Guzzo is here to explain. First of all, when deciding on a plastic surgeon, I think this is, or cosmetic surgery, is it important to go to a plastic surgeon?
I think it's very important to go to a plastic surgeon that's been board certified by the American Board of Plastic Surgery or by the American Board of Facial Aesthetic Surgery.
Why is that?
Both boards set a strict criteria for their members to follow and to become a member of. And so it establishes a certain level of care within the framework of plastic surgery.
Talk about services that Gundersen Lutheran offers. I don't think a lot of people even know that plastic surgery is something that is featured. I don't know if the word prevalently is something that we can use, but you guys are busy.
Right. We're very busy both on a reconstructive side of plastic surgery and the aesthetic side. La Crosse is more of a community that people don't usually talk about plastic surgery. It's not a bigger city like Chicago or LA or New York, and so we have more of a subtle approach to our exposure to the cosmetic plastic surgery side.
So I imagine then that confidentiality is a big part of that.
Confidentiality is very important, as well as getting very good results, because there's a very good chance you're going to see your patients in the grocery store or in the mall, and so we want our patients to be happy.
What are some of the most common things that you do here at Gundersen Lutheran?
Most in our group, I think from an aesthetic side, it's mostly either breast augmentation, breast lifts, or tummy tucks, and those all kind of fall into the mommy makeover package that people hear a lot about in the news and in the media.
You mentioned the mommy makeover, but you also have talked about the importance of a relationship with patients. Tell me why that's a benefit for patients.
I think the benefit is that once that relationship is established with the patient and their plastic surgeon, the patient and the surgeon are more comfortable with each other, have a better understanding of maybe the needs and the wants of the patient, and can better provide the aesthetic results that she's looking for. Specifically with the mommy makeover, that's a very fun aspect of plastic surgery, because I might meet a woman in her 30s, and we start off with less invasive procedures as Botox or fillers, and then progress as she ages into the other more invasive procedures. And establishing a relationship with a patient that could go on for the next 20 years is really exciting and rewarding.
I know that one of the services, too, that maybe we take for granted is that with the Trauma and Emergency Center being a level 2 at Gundersen Lutheran, having that plastic surgeon available is a big part of that, too.
That is correct. And we, along with our trauma exposure, we're frequently involved in our breast cancer center, too. That's probably the area that we're most involved with. Due to the high level of breast care that we offer patients, a lot of reconstruction surgery for that part of the treatment program is performed here.
Well, certainly nice to have those services in La Crosse, even if not everyone is aware of them. Maybe people will be hearing and seeing this, and will certainly be clued in a little bit more about that. One of the things that we brought up is that according to the American Society for Aesthetic Plastic Surgery, or ASAPS, and you mentioned them, men had nearly 1.1 million cosmetic procedures in 2007. Now that's men. Among them, from what I'm understanding, are most popular things like mainly the cosmetic things, the Botox, the laser hair removal, liposuction, eyelid surgery, rhinoplasty, even breast reduction. Mm-hmm. Talk about the men aspect.
Well, in general, cosmetic surgery is becoming more and more accepted in our society, and it's less taboo than it was maybe 20 years ago. And men also, everybody ages, and the signs of aging on men are just as, it can be just as big of an impact to how they feel about themselves. And so more and more men are coming in and asking what can be done to kind of slow down or reverse the signs of aging.
I think that might surprise a lot of people, but what do men come in and say to you? Because obviously it takes a big step for many men to kind of say, hey, I think I'd like some help. What's the first thing that they say to you?
Well, it depends on the age of the patient. So in the younger age group, in the 30s, 40s, it could be wrinkles that they're unhappy with, and maybe simple procedures like Botox or filler injections. As the patients get older, men are more interested in taking care of maybe some extra skin around the eyelids to have the droopiness of the eyelids reversed, or facelifts to tighten up the overall appearance of their facial structures. However, men also are interested in the tummy tuck as well, and that can be from the everyday athlete that just can't seem to get rid of the saddlebags or the rolls along the waistline, and that could be treated either with liposuction or tummy tucks.
And again, a lot of confidentiality around that because,
Absolutely.
as you said, there are neighbors and certainly people that we see in the grocery store.
That's
too.
right.
From what I understand, and maybe you want to just talk about these a little bit, but I understand that there are some pretty common questions that a person should ask about their surgeon, or and maybe I should just run down those questions. Are you trained specifically in the field of plastic surgery? Why is that important?
It all goes back into training, and it goes into what level of experience you have, not to do the procedure, but to assess the problem and to know if this procedure is going to adequately address my concern. And as well as, is the physician able to take care of the problems that could happen with any of these procedures? So it's really safety, and then achieving the results that both the patient and the plastic surgeon are trying to achieve.
Some of the other questions are, how many years of plastic surgery training have you had? I think that speaks for itself. Do you have hospital privileges to perform this procedure? And is the office-based surgical facility accredited by a nationally or state-recognized accrediting agency, or is it state-licensed or Medicare certified? Why is that so important?
That's important in areas where frequently plastic surgeons do a lot in their office or in their own surgery center. Now, our office, we use our accredited ORs, so it's not as big of a concern. But if a patient is going somewhere and they're going to have a procedure done, and it's going to be outside of a hospital, they need to make sure that the appropriate safety measures have been followed by that surgical center, and that if something happens, they're going to be able to respond and take care of that patient.
Certainly makes sense. Dr. Guzzo,
Yes.
Thanks for your time today. We appreciate it.
Thank you very much.
Once again, whether you're a teenager with acne, a cancer survivor who needs reconstructive surgery, an empty nester looking to diminish fine lines, or simply just looking for the latest technology in plastic and reconstructive surgery, Gundersen Lutheran can certainly help rejuvenate your look and, of course, your life. Contact Gundersen Lutheran Plastic and Reconstructive Surgery at area code 608-775-2376 for a confidential consultation. Again, that's area code 608-775-2376. When we come back, there is a pediatric neurosurgeon in town. What does that mean for parents in our area? Reporter Brian Gilberts talks to Dr. Edison McDaniel to find out. That's next on It's Personal, brought to you by Gundersen Lutheran.